Any questions?
Okay, so I'm going to be going over community access, the chaptered bills. All of the chaptered bills were supported by ARCA, so that makes things a little bit nicer. AB 169, guide, signal, service dogs, injury, or death, which was supported. Under existing law, it is an infraction or misdemeanor for a person to permit a dog that is owned, harbored, or controlled by a person to cause injury to or death of a guide, signal, or service dog. So existing law makes a person who intentionally causes injury to or death of a guide, signal, or service dog guilty of a misdemeanor.
Should be
The bill would require the defendant convicted of either crime to pay restitution to the person for medical or medical-related expenses or for the lost wages or income occurred to the person with the disability. This would also include the replacement cost of the dog, including training of a new dog. The cost would also include the keeping of a now disabled dog. So if the dog was only disabled, not killed, the person convicted of the crime would have to pay for services for the disabled dog. So if he's in a kennel or needs additional training or anything of that nature, the defendant would have to pay for that as well. Okay, AB 462 in-home support services program. So it requires CDSS in consultation with the Department of Healthcare Services and its stakeholders to develop a standard medical certification form for use in all counties to contain certain information and further prohibit this form from requiring a health professional to certify an applicant's or recipient's need for individual IHS service. The documentation would be accepted by all counties as a way to meet the medical certification, and it would require DHCS to provide notice directing all Medi-Cal managed healthcare plans to assess all Medi-Cal recipients who are applying for or receiving IHSS in order to make the required medical certifications. So essentially it's trying to streamline everything. This was covered in the community safety section, AB 439, juvenile competency, so I will not go over that. Deaf and disabled telecommunications program. Existing law establishes the requirements for deaf and disabled telecommunications program. It requires the commission until January 1st of 2020 to establish a rate recovery mechanism through a surcharge not to exceed 0.5% or 1% uniformly applied to the subscriber. This bill would extend the collection of the surcharge through January 1st, 2025. It would then allow the telecommunications universal service programs to be supported through January 1st, 2026. So over 4 million Californians have some level of disability that inhibit their ability to use a telephone due to difficulty seeing, hearing, speaking, moving, learning, or remembering. AB 737, residential care facilities for elderly, licensing and regulation, which was supported. What happens is RCFEs a lot of times will use LLCs, limited liability corporations, and the individual owners and operators of the RCFEs are hidden from CCLD, and their connections to poorly managed facilities aren't usually considered. The lack of information protects the owners and operators with bad track records and enables them to proliferate. This bill enhances CCLD's ability to connect entities to people, so there's a clear picture of who we're responsible for the care provided in each new RCFE. So it adds a level of transparency. This bill will further propose that by allowing the Department of Social Services to track RCFEs held by LLC companies that do not have to report their LLCs. So with some LLCs, how it used to be is if you owned less than 10%, you didn't have to indicate who that was. So if you had 11 people owning less than 10%, you really didn't have to know who those people were. So I believe now it's 5%. So now ownership is identified, so we actually know who owns the companies. So the people who are receiving the services actually know what they're getting. Program of all-inclusive care for elderly. So this is the PACE program. It provides community-based, risk-based, and long-term care services through a Medi-Cal state plan. This existing law authorizes the State Department of Healthcare Services to enter into contracts with various entities for the purpose of implementing the PACE program and fully implementing a single state agency responsibilities assumed by the department pursuant of these contracts. So this bill would exempt from licensure by State Department of Public Health a primary care clinic, an adult day program, or adult day care center, or home health agency that is approved by the Department of Healthcare Services to operate exclusively as part of a PACE program. So it wants to, my understanding is for everything to be streamlined and allowing, again, more transparency. The bill would subject those entities to oversight and regulation by the State Department of Healthcare Services. It would require those entities to comply with operating standards described in their respective provisions and to meet the needs of PACE participants or those individuals being assessed. The bill would require the department to establish an administrative fee to be paid by each of the PACE organizations in an amount necessary to pay for reasonable costs of implementing and administering or administering these provisions. The bill would create a special fund, the PACE Oversight Fund of the State Department of Healthcare Services, where the fees will be deposited and expended upon based on legislature. All right, AB 1351, Transit Operators, Paratransit Dial-a-Ride Services Assessment. So according to the author, AB 1351 fosters a collaboration between California State Transportation Agency and local public transit operators with the goal of assessing policies and procedures regarding to paratransit services for individuals with physical and developmental disabilities. Those eligible for paratransit services experience difficulty using paratransit services when they leave the service area of their primary residence. This bill allows stakeholders to identify any barriers or lags when it comes to allowing an eligible person to access paratransit services. Okay, so there's quite a bit of information in, now the second chapter bill regarding deaf and disabled telecommunications. So this AB 1514, basically, it allows a nurse practitioner to certify that a person needs the service. So instead of having to get it from a physician or a surgeon, and now a nurse practitioner can do that, and that hopefully will make things a little bit easier and accessible. Autism, sensory-friendly movie screenings, support. So there was a lot of language in here about autism spectrum disorder and the needs of people with autism. But basically, the legislature supports and promotes expansion of sensory-friendly movie screenings and similar programs and encourages families to attend sensory-friendly movie screenings during April of 2019. So this already happened. which is National Autism Awareness Month. So, the government supports sensory screening, sensory stuff. Okay, so community access, we covered that in community safety, so we need to go over that. Okay, SB 744, Planning and Zoning, California Environmental Quality Act, Permanent Supportive Housing. So there's a lot of information in this, but basically, and Tony, please correct me if I'm wrong, the legislature passed AB 2172, which was supposed to streamline projects for supportive housing projects, but there still appear to be some issues related to permits and use of area. And the developers were required to include facilities and on-site services for residents of the supporting housing units. So developers were to provide local governments with the name of a service provider, staffing levels, and funding sources for the services. So then with SB 744, No Place Like Home came into effect, right? Hopefully. In 2016, California voters approved Proposition 2, No Place Like Home, which made $2 billion in bond funds available to counties for efforts to assist people who are experiencing homelessness and suffering from serious mental illness to find stable housing and treatment through the construction of and operation of supported housing. So it sounds like it's this SB 744 is supposed to clarify that supportive housing developments meet specific requirements and have applied for but have not received funding under the approval of AB 2162. So it sounds like right now they're trying to make sure that some of the loose ends from the AB 2162 are addressed with the SB 744 to make sure that the housing has all of the supports that's necessary to treat the people who are supposed to be living there. Okay, so Senate Joint Resolution, I'm sure you are all aware California's roads are not ideal. 44% of major roads and highways are considered in poor condition and 25% are rated mediocre. It's even worse in urban areas with 53% of major roads and highways in poor condition and 25% is mediocre. California motorists are spending in excess of $22 billion annually, which is about $843 per driver on as a result of poorly maintained roads. They're expecting California's population to grow by 48 million by 2040, which is going to be interesting if that's what happens. And also with freight transportation and railways, because California is the gateway to international trade, our entry points are nearly 1/5 of the country's imports come through California. So California legislature has basically identified that we have a problem and has resolved that the Senate and Assembly of the State of California jointly urges Congress and the President of the United States to work together to reenact a robust bipartisan federal infrastructure to restore California and address the shortfall of the Federal Highway Trust Fund by restoring the lost purchasing power of federal fuel tax in order to provide the long-term funding stability necessary for California and other states to rebuild infrastructure. So basically, it's everybody thinks we have a road problem and has said to the President and Congress they need to help us figure this out. But there's no information on how that's going to happen. And next is Tony. Does anybody have any questions about anything? No? Okay.
I feel like I should.
Huh?
I feel like I should, but I'm not sure what. Yes, what is California?
Okay, education. So we have three bills here. AB 605, AB 1172, and a Senate resolution. So AB 605, Manshine. This one has to do with assistive technology. And so the, oh, thank you. So this bill says basically that when it was established that you need assistive technology to access all the services related to your education, that you would be able to access that anywhere. So I guess there's some places where it would just stay at the school. So this would clarify that. So everybody understood that that's not the case. You should be able to have continued access even if you're enrolled in another local education agency. I always want to say area, but agency, local education agency. So there have been some confusion around that, so that kind of clarifies that as well. If you leave, you don't have to give it right back. So you need to be able to access the information so that you can get your education. And then you would also keep it with you until the new LEA could replace it or buy another one or figure out how you would get it. So you wouldn't lose it right away, and there'd be some process, some timeline for that new LEA to replace it. 2 months is the timeline that they're giving. So, and that is Manshine on assistive technology. Good, those are good clarifications. Fraser, AB 1172, special education, non-public, non-sectarian schools. Now this one was done in response to the terrible tragedy that we had in just north of here related to a non-public school, and a child passed away. They were using some restraint processes that were not safe, and the child died in the process. So this is to sort of begin to address this issue. Requires additional training for these schools. They're not held to the same standard. So this bill says that all staff who have any contact or interaction with pupils, that they be trained in the use of and practices and interventions specified in the school's plans for the student, and that the training must be provided within 30 days of their employment. So first, everybody who's there, but then any new employee would have to be trained in safe procedures. So that now is in statute. The training would include positive behavioral intervention supports, and including the collection and analysis of data, which is very important, and how to implement the behavioral plans. It would be training specific to the students and in general, and how to understand and address challenging behaviors, and then evidence-based interventions for reducing and replacing challenging behaviors. So some of the standards that people may be used to in some schools, but wanting to be very specific in the private non-public schools. Not that they were all not doing it, but this clarified that they will all not do it. And then a Senate Joint Resolution 8 by Wilk, and it's one of my favorite ones, special education funding. It is an annual bill or an annual resolution that the state does, and the state every year says that Congress should fully fund IDEA. And so we will make sure that Congress understands that they should do that. And it's a reminder that they're not. Congress does the same thing every year and says we should fund this completely, and then that's it. So, but at least it's a recognition. That's what it is. It's a recognition that it's not fully funded, although it is an entitlement and a right to all students with disabilities. Next one. Who has this next time?
Well, you're doing a good job.
I do. I have this next topic. This one is 365 Garcia, State Civil Service Examination. Now, this was a bill to try to improve employment of people with disabilities in the state services, and it was vetoed. So that's the bad news. But the governor did say that that this can be handled administratively, that our departments do talk with one another already, so you don't have to force it. And then also, there is a state diversity task force that was just created. And disability employment is, disability is a diversity community, a diverse community, and well, it should be part of that conversation, which is a good thing. They should be definitely part of that conversation when the state is looking at their workforce in terms of the diversity task force. So that's why he did that for now, and I'm sure if that doesn't work, then he'll probably accept the next one. Health. Is that me too?
Yep.
Good job.
Yes,
And
me
mental
too.
health, just keep going.
Just keep going. Who's recording these? Okay, health. Oh, only 2 bills and then 1 vetoed bill. So, AB 744. Here you go. Oh, telehealth. So it specifies that face-to-face contact between a healthcare provider and a patient is not required. Now, that might sound odd, but it's important because it was stated or believed that it was required. So it is no longer required, and it allows for people to receive healthcare through telehealth. So just some technicalities had to be put in place to allow for that. The healthcare payer shall reimburse at the full rate. There was some question of whether you pay them less. So I'll clarify that one. And authorizes the payer to offer a policy containing co-payment and co-insurance that includes telehealth as part of the services. And it requires telehealth services covered under healthcare service plans to be subject to the same exact deductibles and annual lifetime benefits and things of that nature, to be treated the same as the others. Program of all-inclusive care for the elderly. This was already covered, or was already covered, nice. There are a few you may wonder why they pop up, because each of us have our areas that we're supposed to study as part of the board's committee, the legislative committee, and so some topics or some bills crossover topics. So some of our members study more than one, and then when we decide on the order, then that person doesn't have to do that. So, restorative dental services that would support this bill was vetoed, and also we have a handout for you on the bills, but we'll also have these that we have that have these great amount of detail, a little more background and history, and we'll share that with you all. That'll be on our website later. But you have those. So on this particular bill, SB 154, Medi-Cal Restorative Dental, the governor did veto. His message was to the members that he's returning this bill, SB 154, without a signature. The bill would allow Medi-Cal dental providers to provide and be reimbursed for the application of silver diamine fluoride when used as an arresting agent for cavities. So it recognizes the importance of this this procedure, but says that it will actually cause great increases in the budget, and so therefore it should have been handled in the budget process instead. Well, he writes the budget, right? So he didn't include it in that one, so maybe this one it will be in there. But if not, what he's saying is that needs to go through a different process since it will have such a large impact on the state budget. Mental health. That's gotta be someone else.
It's you.
That's gotta be me. Any questions on any of those so far? Good, because there is a test later. There's a big one. So mental health, SB 389 Hertzberg, mental health services. And then we'll cover two bills quickly that were vetoed. So, 389. This bill amends the Mental Health Services Act to authorize counties to provide services to persons who are participating in the pre-sentencing or post-sentencing diversion program. So it expands. There was a belief that these folks were not eligible to receive any support services that were covered under the MHSA, and that's not. This now clears that up, make sure that they can receive that support. So the bill amends the Mental Health Services Act itself to authorize counties to provide services to persons who are participating in pre-sentencing and post-sentencing, and who are in parole, probation, post-release community supervision, or mandatory supervision. And the bill asserts that action further this is in line with the intent of the Mental Health Services Act. You cannot make an amendment to the Mental Health Services Act that is not germane to the purpose. Mental Health Services Peer Support Specialist Certification. There was a proposal because there's a belief that peer supports in mental health can be very effective for serving people, and but there was a need for certification, and this bill was vetoed. And the reason it was vetoed was that he said that there needed to be a more comprehensive look at peer supports. Also, that he did recognize the importance of the peer supports and what they play in an individual's recovery or in their mental health, and but that it would also create a significant cost. And costs, when they're significant, of course, you're going to say it needs to be in the budget process. So basically, do more work in this area, understand the issue more, and then if we do this, it needs to be in the budget process. And then the last one is pervasive developmental services, autism. The bill inadvertently creates a conflict. So there was belief that there was a conflict that this bill would create within the Medi-Cal program that could result in unintentional delays in access to care that jeopardizes the receipt of FFP, which is the federal financial participation. So this one didn't go any further because they said it was not going to work administratively. So we won't go too much into it, although it would change the qualification standards necessary for autism service professionals and paraprofessionals. So that would have gone in there as well. I didn't spend too much time on that one since it did die, but just it is moving right along. Housing? Robert? Oh, he's sick today too. Okay. Would you like me to do the housing one?
All right, go ahead.
Let's see what we got. All right, discrimination, housing, source of income, support. Okay, so this one here would make this particular change here. So the the California Fair Employment and Housing Act prohibits housing discrimination, including discrimination on a variety of factors, including the source of income. And that's what this bill will get at regarding your eligibility or how you are viewed in your application. So the term source of income is now expanded to mean lawful, verifiable income paid directly to a tenant or paid to a representative of a tenant. So that otherwise it wouldn't establish that you had income. It increases the income level on your application. So it makes you more viable as an applicant. And paid to a housing owner or landlord on behalf of the tenant. So if you were receiving supports, housing supports, and it went to the landlord directly, you should be able to count that as part of your assets or your income. And so now you can. And the law now specifies that housing owner is not considered a representative of the tenant. So wanted to make sure that was clear. So that, it's actually very important for people that are not qualifying for housing because of income being too low. So the next one, SB 450, California Environmental Quality Act exemption, supportive and transitional housing motel conversion. So now projects related to the conversion of a structure with a certificate of occupancy as a motel, hotel, residential hotel, hostel, or supportive of transitional housing can be exempted under certain conditions. So if you're converting one of these over, the sequel, the California Environmental Quality Act, is very comprehensive. It can take a long time and can be prohibitive sometimes cost-wise, and so there's some exemptions that they're providing because we have a housing crisis in the state. So that's why this was done. It's an exemption. And the last one on housing, I think it's the last one, housing elderly and individuals with disability. This was vetoed. Why would you do that, right? So he's already directed the Secretary of Health and Human Services Agency, Dr. Ghali, to work on a broad array of stakeholders to develop a master plan for aging. And part of this master plan includes housing. So when the master plan is completed, we can then reevaluate that and decide what public policy issues need to be in place in response to whatever the master plan committee comes up with. So doesn't want to get ahead of the game. Maybe they'll come up with other recommendations. All right. Questions? Who's next? Board governance. So this is Regional Center Board governance. These were done during the year. Most of these, they were all done in TBL, trailer bill language. So all these do are set in motion new requirements for board members. So I see a lot of board members here today, and thanks for being here today. And these are some of the new rules that govern how the board operates. So regional center boards must include financial and governance or management expertise. So there must be some people on the board of directors who have this experience and background. Regional center boards not in compliance with the composition requirements must submit a plan. The plan will say what we're going to do to become compliant. And then regional